Recent trends in the international migration of health workers have resulted in an uneven global distribution. According to the World Health Organization, 57 countries are currently experiencing a critical shortage of health workers, compromising their ability to deliver healthcare and ensure the health of their citizens. 17 of these countries are members of the Commonwealth. Current migration patterns reflect the increased reliance of high-income countries on international recruitment to meet their demand for health workers. Countries such as Sri Lanka, which act as sources for international health worker recruitment, find their ability to provide healthcare and public health to their citizens severely compromised, given the loss of both significant numbers of health workers and those with specialised training.
I have produced 64 mental health consultants in the country at an enormous cost and expenses to the taxpayers of my country, because in my country both health and education are entirely free. The medical education is entirely free. So they have gone away, and I am only remain with 20 mental health consultants.
Codes of practice for the international recruitment of health workers are one response to this crisis. The Commonwealth Secretariat introduced its Code of Practice for the international migration of health workers in 2003.
It is hoped that it will provide a framework within which international recruitment should take place and, in a way, bring more order to international recruitment, try and stop the active, targeted recruitment which is happening in some countries, try at the same time to uphold the rights of migrants, health workers, but at the same time trying to balance that against the rights of a country to provide health services to its citizens.
The World Health Organization is currently developing a global code for the international recruitment of health workers in line with what is advocated by the Commonwealth Code. The code will emphasize that recruiting countries should consider the impact of health worker migration on source countries.
A code is a non-legally binding document, but we encourage member states to read it, to let it guide them. And that way we can at least ensure that there is some fairness and transparency as far as recruitment of health personnel is concerned.
It's a voluntary code, so I think we need civil society and wider elements in every country to say this is actually a life and death issue. So even though it's a voluntary code, we desperately have to address the health worker crisis.
Health worker migration is a complex issue, and a successful policy response demands a range of actions from all those involved. Lessons can also be learnt from the strategies adopted by some source countries. The Philippines has been very proactive in managing health worker migration.
We need to set up a regulatory framework so that any effort to get people from your country would have to reckon with that regulatory framework to begin with. And then over the years, you have to establish other things like seeing to it that there is a contract that can be verified and enforceable within the country. And then we've set up institutions that put Filipinos in the places where we have other Filipinos working so that they're taken care of, counseled when necessary, brought to justice with the help of advocates and lawyers so that their rights could be protected.
The ability of countries to deliver healthcare and ensure the health of their citizens will be strengthened by sharing experiences such as these and by implementing an effective global code.